Alright guys, we're back, and let's talk about a drug that helps us out a lot for our fluid overloaded patients. When we gave that big bolus of fluid before, looking down and seeing that they got really big swollen ankles and gigantic external jugular veins. And that, of course, is bumetanide, bumetanide, but that is more commonly known as Bumex. And again, I will tell you that locally here, it's being pulled off the trucks, and I'll explain why here in just a second. It's used to lower the amount of water and salt in your body by increasing the output of urine. It's a loop diuretic. It works very similar to how furosemide works. Okay, it works on a little bit different action, and it's a lot more potent. Okay, so when we're given 1 to 2 milligrams of Bumex versus 80 milligrams of Lasix, and somebody that's on Lasix chronically tend to respond a little bit better to Bumex. Okay, now, so again, it inhibits the sodium reabsorption, and also reabsorption of chlorine is blocked as well, but it allows 40 times the more greater effects of diuresis than Lasix, which is why, again, a lot of the docs like it. You don't have to give as much, and they will pee a little bit more. Usually takes about 5 to 10 minutes. Lasix is about the same. They're a little bit longer for Lasix, but it's a kind of a moderate onset, and it usually lasts for 2 to 4 hours, where Lasix is a little bit longer. So again, it's a short-acting diuretic. This isn't necessarily a bad thing. So it's used to treat CHF, again, that fluid overload. If you got patients with liver or kidney disease, this helps to draw off more fluid, okay? And definitely in the CHF case, that's a very good thing. So with that, when you start pulling fluid off of somebody, again, you can get hemodynamic changes, which usually causes the headache, the vertigo, the weakness. Kind of messes with your electrolytes too, which also can cause that. The salt removal actually is what probably causes the tinnitus. It can drop your blood pressure, and I can't stress that one enough. You can't just go willy-nilly on this drug. They got to have a decent blood pressure. It will drop it, especially when you push it fast, but they're going to start peeing, and it takes the fluid out of the circulating system, which again can cause issues. All right. Now your GI, again, it can cause nausea, vomiting, diarrhea, again, cause abdominal pain, just plain out regular abdominal pain with that. And again, usually because it changes your blood chemistries, you may get muscle cramps and pains in there. Remember, it messes with your chlorine and your sodium. So again, it can cause a rash. It can cause you to become dehydrated. All right. Again, when do you not use Bumex? If they're not peeing, don't give them Bumex, because it's not going to work. It's not going to magically start their kidneys. Okay. So if they are still peeing, then yeah, we want to give them the Bumex. But again, you got to ask them before you give it to them. Hey, are you still making urine? And a quantity that's enough where you feel safe giving it. Okay. If their blood pressure's low, don't do it. If they are in a liver failure, in which they are in a coma, you can push this, but it's not going to really help. And again, we need to get them dialyzed at that point if they're that far gone. But it can cause, if they are dehydrated, if they have electrolyte problems, I would probably hold up on giving that. Again, if you know about the problem. All right. Now, patients taking aminoglycoside antibiotics, except in life-threatening condition, don't give this drug. Okay? Avoid it. And again, ask, and if they're on an antibiotic, double check that it's not an aminoglycoside. Again, and again, pull up your WebMD, pull up Google. This is a great time to do it, and may potentiate the effects of the various hypertensive medicines. Okay. So again, it's going to cause a lot of the hypertensive medicines that we use, by the way, are excuse me, guys. A lot of the antihypertensive medicines that we use, again, is they're water pills essentially. So they lower blood pressure by removing the volume that's in the bloodstream, which then reduces blood pressure, and we don't want to do that. Now, again, make sure that we don't show the Bumex the light. It should be in a dark vial. It should be kept out of the sunlight. Ototoxicity and deafness can occur with rapid administration. So if you push it fast and they go deaf on you, That one's on you. All right, give it slow, real slow. Patient should be catheterized if you got a transport that's going to be greater than 15 minutes. Sometimes we don't have that. But guys, remember, it acts in about 5 to 10 minutes, and it's 40 times more potent. You're going to have somebody peeing big time. Be ready for it. Again, rapid diuresis can lead to the low blood pressure, and actually you can start throwing blood clots because of it. And again, it is known to cause fetal abnormalities. So if mom has any chance of being pregnant, we don't give this to kids at all. Okay. So again, usually it's 1 milligram in a 4 ml vial. That's the one that I've commonly seen. Every now and then you might see it in a multi-dose vial. Probably not. How we give this though? If they are a small person that's lower than 70 kilos, we usually give them just 1 milligram. If they're above 70 kilos, we give them 2 milligrams. Pretty simple. Okay. It's not a weight-based drug other than the 70 is the cutoff there. And again, we don't use it for kids. Not recommended for pre-hospital use. All right. We only give it IV. We do not give this IM. We do not. You can give it IO, obviously. And again, it's the pregnancy category. They're not really sure about it. Again, not too much testing on that. All right, that does it for Bumex. It's actually kind of an easy one. Again, big things. Give it slow. The reason you want to give it slow and over a long period of time is so you don't have the deafness occur and you don't have the hypotension pop out. All right, we'll see you on the next one.